A neighborhood is more than a geographic location. It's the people who live there and go to school there and build a community there. At MU Healthcare, we believe each of Columbia's neighborhoods should have reliable access to healthcare too.
That's what the Battle Avenue Medical Building is all about, creating healthy, happy neighborhoods where the entire family can get the everyday care they need.
Expanding primary care services to the north side of Columbia has been one of our goals for a long time. Right now, there are more than 50 primary care, quick care, and urgent care clinics in Columbia, but only one other clinic located north of I-70. Battle Avenue Medical Building brings much needed access to health care to the north side of Columbia, where more than a third of the population lives.
Expectant mothers can see their OBGYN here, and their kids can grow up seeing a pediatrician or family medicine doctor in the same building. And if a patient needs to see a specialist, then we'll coordinate that care for them, making sure it's a smooth transition.
Behavioral health is the most in-demand service across the state of Missouri. The addition of new providers here will help improve access to mental health care in Columbia through both virtual and in-person appointments.
The Battle Avenue Medical Building offers lab services and physical therapy on site, and the drive-through pharmacies should make it easier for folks on the north side of town to pick up their medications. It's available for anyone in the community to use, even if they don't see a doctor at this location.
Now, more than ever, it's important for families to have access to medical care close to home. We are excited to expand our services at Battle Avenue Medical Building and bring easy, convenient care to Northeast Columbia.
For those of you who are just meeting for the first time, I'm Rick Barron, the Executive Vice Chancellor for Health Affairs, and I just got here in May, so I'm pretty new. And I think when I was planning to come here, the Battle Clinic didn't come up. I first heard about it in May after I got here and all the excitement about opening up this new clinic, so now here we are. So this is my first open house for a new clinic space, which happens frequently in our healthcare system, I see. So this is really a great facility, and I can see it's really going to serve our community in this part of Columbia. So this is really special. Normally we would have a big crowd here because of COVID. We have to have some social distancing, so we're improvising just a little bit. But I'm joined here by my two partners at MU Healthcare, Jonathan Curtright, who's the CEO of MU Healthcare, and Dean Stephen Zweig of the School of Medicine. And we have an amazing leadership team in our healthcare system that I've gotten to know really well since I've been here for the last 7 months. And it's really, truly integrated healthcare system between the patient service healthcare system side that Jonathan runs and the teaching and research and also service side that Dean Zweig runs. It's an amazing partnership that I'm glad to be part of the team. So this building that we're commemorating today, the Battle Avenue Medical Building, is another example to show how aligned we were. As I was walking through with Steve and Jonathan and Pam Mulholland, who had a lot to do with planning this building initially, I could see how much teamwork went into planning this building. And it's truly a nice thing to see, and I see it every day in our operation. So the clinic and the great services it will provide to our community really couldn't be possible without this amazing collaboration between MU Health System and MU School of Medicine. So some of you may know, but others may not, that we recently updated and finalized our mission, vision, and value statement for our academic health system. And Marty McCormick, who's here, was a key to helping us finalize that. And it was really a big achievement because now we don't have a separate vision and strategic plan for the hospital and for the School of Medicine. It's all one vision and strategic plan. And so our new mission is to save and improve lives through exemplary education, research, and patient care. So that mission really is straightforward, but it's very elegant and simple phraseology in how it ties together complex relationships and goals into one actionable idea. And it really has many implications for how we deliver care and advance our educational pursuits as for Missourians. So now I'm going to introduce one of the other three amigos, as we like to call ourselves, Jonathan Curtright, the CEO of MU Healthcare System, to share more about how we'll care for patients in this new clinic. Jonathan.
Thank you very much, Dr. Barron. And I think I'm socially distanced, so if you don't mind, I'm going to take this off just a second. Well, as Dr. Barron got to say, I believe this is his first official ribbon cutting, if you will, grand opening. I've had the privilege now of doing this, I think about at least a half dozen times or so. Boy, it's always so much fun. It's always so fun to see the people that are actually going to take care of patients in the space, the smiles that they have, that this is just going to be their new home. It's such a glorious thing. And part of the reason why it's also fun that we're getting to do these grand openings is it's symbolic, right? It's symbolic of change and growth, and that we are here to take care of our community, right? We just announced last week that we're going to be able to make a major investment in a new children's hospital, Women's Children's Hospital at University Hospital campus. And the curators and the University of Missouri overall continue to just make great investments in MU Healthcare, and we consider it a privilege and an honor that we get to do that. So growth is a really good thing. Now, those of you that don't know my background, I'm an ambulatory person at heart. I love ambulatory services. This is, to me, this is where healthcare happens in so many regards. And if you think about it, MU Healthcare, I would argue, is truly one of the best primary care academic medical centers in the United States, period. We now have facilities, and Pam Mulholland and I were just talking about this, at Columbia Family Medicine Group, Keene, South Providence Medical, Smiley, Fairview, and now Battle Clinic. Every quadrant of the city, every area of the city, we once again are making major investments to ensure that there's primary care services right here in Columbia to take care of our patients. And how could I forget Ashland? Once again, how can we take care of Columbia and Boone County more and more? We consider it a part of our job providing primary care right here in the neighborhoods in Columbia. All right, so we've had the glorious privilege of just getting this great tour, right? And there's 30 exam rooms, there's 28,000 square feet, there's pharmacy, there's lab, right? There's physical therapy, there's family medicine, OB, and psychiatry, all right here. And it's directly across from Battle High School. I think the beauty of this is that this has got to be one of the most fastest growing places in Boone County and Columbia. And we are going to make this, we've made this major investment, and we consider it a privilege to get a chance to do this. So thank you so much for coming out, and we're going to be doing some great things. I think it's a wonderful testament to the team that we get to celebrate like we are today. And it's my sincere pleasure, and I think it's the symbolism of I think this is incredibly important. Dr. Zweig, the former chair of family medicine at MU Healthcare, this is where his colleagues, his team is going to be practicing under the leadership of Dr. Lane Walker and Dr. Lefevre and Dr. Wynn. And so with that, I'd like to introduce my colleague, Dr. Steve Zweig, the Dean of the School of Medicine. Steve?
Thanks a lot, Jonathan and Rick, and thank you all for welcoming us here today into your new space. This is great, and I really appreciate Jonathan for you continuing to support our ambulatory care services and the growth that we've accomplished over the last years. You've been here 10 years and seen a variety of openings in my advanced age. In almost 40 years now, I got to actually be at the ribbon cutting for the first clinic that was off-site of MU Healthcare's location. And that was on Green Meadows. And then we, of course, have had new clinics at Smiley Lane and South Providence and Fayette, Ashland. We also have 2 practices in Fulton and 1 in Fayette and now in Booneville. So primary care has expanded substantially. So I want to thank everybody who has made this possible today, and you know, we couldn't be here without the great work of all the people who helped to design and build this place. And I see Pam Mulholland and Stephanie Cordray, who were the leaders of putting this together, and Dr. Lane Young Walker, chair of psychiatry, and the chairs of OB, Dr. Nguyen, and family medicine, Dr. Lefevre, and child health, Dr. Gazal. I know we're all very much involved in this. And it really takes a collaborative effort to bring an idea like this to fruition. So I think it's important for everybody to know that when choosing a healthcare provider, they can come to an environment like this and be safe and be assured that they're getting excellent care. And it's an uncertain time and a difficult time for our community and across the country. And I think that we will stand for getting the best possible care available during this whole time period. And the caregivers that we have assembled to work in this practice are among that group. I'm really thrilled to have Dr. Ashley Millam, who's agreed to serve as the first medical director. She's an experienced family physician who also went to medical school here and did her residency in family medicine here at MU Healthcare. And I know that everybody who comes through here is going to receive the care from talented and committed physicians, nurses, and other providers. Now, as we go forward, the role of medical director will be rotated across the various disciplines to help to sustain the collaborative environment that we hope to achieve here. So now I'd like to invite Dr. Millam to join me and Dr. Barron and Mr. Curtright for the ceremonial cutting of the ribbon. One picture right up here. I'll just say thanks to everybody for joining us today and for those who are joining us virtually. I think you're supposed to stay tuned for a tour of the new building. And I think anybody else who is here who wants a tour will be able to do so. So thanks a lot for coming, everybody. Congratulations on your new building.